Plans in the marketplace are presented in 4 metal categories: bronze, silver, gold, and platinum. What does that mean for you? In this video, I'm going to break down the 4 metal categories for the marketplace plans that they are grouped in, and how you can understand which level is best for you. And so if you are new to any of my videos, if you are new to any of my videos, if you are new to my channel or any of my work here that you may have seen on social media, my name is Katrice-The. I am a licensed health insurance broker, and I help African Americans understand and enroll into comprehensive health insurance. And I am also the founder of INSURE Black America, where the mission is to close the coverage gap in healthcare for Black Americans. Now, if you find value in this video or in any other videos here on the channel, go ahead and subscribe so that you will be notified every time I upload a new video. All right, so let's get into this. We're going to be talking about the metal levels, okay? And so on the marketplace, the metal levels are basically just the it goes your co-share, co-insurance. So it's your co-insurance is how much you're going to be paying, okay? Now, the metal categories are based on how, like I just said, how you and your plan split the cost of your health care, okay? It has absolutely nothing to do with your quality of care, okay? And so when you talk about the different levels, if you choose the bronze level, okay, and so the bronze level, or you may see extended bronze as well, but the bronze level is a 60-40 split, meaning that the insurance company will pay 60% and you will pay 40% of the cost, okay? And so this type of plan is for people who you want super low premiums, so your premiums are going to be super low, but you will have the highest cost out of pocket when you need care, okay? And so the deductible is the amount that you pay before the plan will kick in and pay those. Now, on a bronze level plan, I think the cheapest I have seen maybe was $6,000 as far as deductible. I think that may have been in the marketplace. That may have been the cheapest that I have seen is $6,000. Okay, and so you will have to pay $6,000 out of pocket before the plan will kick in and pay anything. Okay, and so that 40%, that 60-40, okay, that is after you meet your deductible. So you meet the deductible first, and then the plan will pay 60 and you will pay 40, okay? Now, a bronze or extended bronze plan, that type of plan is a good choice if you want a low-cost way to protect yourself from worst-case medical scenarios like serious sickness or injury, okay? Your monthly premium will be low, but you will have to pay for most routine care yourself, okay? So if you're somebody that doesn't go to the doctor a lot, maybe 1 or 2 times a year, and you just want to make sure that you have health insurance in place in case something happens, like sickness or injury, then a bronze level plan would be good for you, okay? And so then the next level would be a silver level plan. And so that cost share is the insurance company will pay 70% and you will pay 30%, okay? And so silver level plans have a moderate monthly premium, okay? So you do pay more for a silver level plan, okay? It also has a moderate cost when you need care, okay? So a silver level plan will pay more. The plan will pay more than you will pay, okay? Now, the deductible on the silver level plans, okay, is normally way lower than those on a bronze plan, okay? And so when the marketplace, the silver level plans, they do reduced cost sharing on those plans, okay? So you can save more per year if you choose a silver level plan because the cost sharing is reduced, okay? So if you qualify for the extra savings or not, whether you qualify or not, if you choose a silver level plan, okay, so you will be paying slightly higher premium than the bronze, but you will have more of your routine care covered. So if you're somebody that you go to the doctor maybe 3-4 times a year, or if maybe you have like an illness that needs to be managed, so you have like something like high blood pressure or diabetes, something like that has to be managed, so you go to the doctor a little more during the year, or you may see a specialist, a silver level plan would be good for you, okay? Now the gold level plans are insurance will pay 80% and then you will pay 20%, okay? These premiums are kind of high, just depending on what high is to you. The lowest gold I've seen, and also with the marketplace, it does also depend on your tax credit, how much tax credit you got. Depends on what your premiums is. Now the gold level plans, the premiums are higher, but when you actually are using the insurance, you are not spending a lot out of pocket, okay? The deductibles are usually low. You can get them at, say, maybe $2,500, $1,500. Sometimes I've even seen them at like $250 for the gold level. Okay, and so a gold level plan is a good choice for you if you are willing to pay more each month to have more costs covered when you get medical treatment. And if you use a lot of care, a gold plan for you would be a good value. Okay, and then the last level is the platinum plan. And on a platinum level plan, the plan will pay 90% of the cost and you'll pay 10% of the cost. And this again is after you have met your deductible, okay? And so the highest premiums will be platinum level plans, okay? I don't think, not all carriers offer platinum level plans. But if they do have the highest monthly premiums and they have the lowest cost when you get care. And the deductibles are super duper low, meaning that your plan will start paying its share earlier than other carriers. Now, in all of the levels I've seen where you can get a plan at a $0 deductible, so the plan will kick in right away and start paying their share. You can find those. But what I've also seen is that, especially on the bronze level, if it's a $0 deductible, they're making up for that in another area. So you may have a $5,000 deductible on your drug cost, okay? And so any drugs that start from tier 2 to 5, or however many tiers they have on their drug, on their formulary, you have to meet a $5,000 deductible before they will start to pay anything on the medications, just depending on where your medication will fall. Also, you'll pay more to see your primary care and a specialist, okay? So you pay more out of pocket on a bronze level, $0 deductible, than you would, say, on a platinum level. The plan will pay 90 and you will pay 10. Platinum level plans are also good for people who use a lot of care and you're willing to pay a high monthly premium. But you know you're paying this premium because the majority of all of your costs are going to be covered. You're only going to be responsible for 10% out of pocket, okay? So you have to just, when it comes to your plan, you have to just really sit down and assess, okay, what are my needs, okay? And so that's why if you followed me or watched any of my videos for a while, you will see that I am a very big advocate for doing a health needs assessment, okay? Because doing a health needs assessment, it lets you see what your health needs are. Because a lot of people, when they are starting to look for plans, they're only looking at the premium. And they're like, oh, the premium's low. Well, I don't get sick anyway, so blah, 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 blah. And they choose this plan, and then something happens. And they're like, oh, no, I forget I take medication, but I just seen this cheap plan, so I just assumed that it would be good, and da, 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 da. And so you choose this plan, and then you're paying a whole lot out of pocket, and now you're upset because your needs aren't being met, and you're having to pay so much out of pocket, even though your premium is low, okay? And so this is why you need to do a health needs assessment first. What are your needs? What are your health needs? Do you take medication? Do you see a doctor regularly? How many times do you see a doctor a year? Do you see any specialists? How many times a year do you see a specialist? How much are you currently paying to see those providers? How much do you want to pay to see those providers? You know, it's questions that you need to, these are things that you need to be asking yourself, because when, you know, looking to purchase health insurance, especially through the marketplace, normally it's one time a year, unless you qualify for a special election period. But normally you get that one time a year, so which starts November 1st. So if you're looking for health insurance and you have this one time a year, and you have to be stuck in that plan until next year, until open enrollment again. And so you can choose a new plan which won't take effect until the following January. It is very, very, very imperative that you do a health needs assessment so that you will not be stuck in a crappy plan for the year, okay? And when I say crappy, I'm not saying like the plan is crappy. It's just that you won't be stuck in a plan where you're paying more out of pocket than you would like to, okay? So it's very, very important that you do a health needs assessment. Now, all plans in all categories provide free preventative care, and some offer free or discounted services before you meet your deductible. So you do have to read your summary of benefits in order to know, you know, if they provide any free or discounted services before the deductible. But all plans provide free preventative care, okay? And so again, the marketplace, when you're looking at marketplace, it is off of your income. And so just depending upon your income, you know, and what you qualify for subsidy, then that will also help to determine, you know, where you need to start looking as far as the levels. And again, at the end of the day, it just depends on, you know, how much you want to spend out of pocket for your premium. And so I hope you found value in this video. If you did, please do like, share, and subscribe so that others may find value as well. If you do, if you want to schedule a free needs assessment with me to go over your healthcare needs so that we can get you in the right plan, you can go to my appointment scheduling page. It is INSUREBlackAmerica.com. You can go there, you schedule a free health needs assessment with me. I do Zoom and telephone, so, you know, some people like Zoom. They like to see who they're working with, so, you know, Zoom and just over the phone is both available. Also, stay tuned. I'm going to be coming up with a little freebie to give away to help you guys to understand reading the summary of benefits. That's going to be coming real soon, so stay tuned for that. All right, guys. Hope you have a great, amazing rest of your day. And remember that together we can close the coverage gap in healthcare for Black Americans. Have a good one.